Just to tell you, thank you. To tell you, yes. So I will tell you a little bit about myself. I was born here in East Los Angeles. I am first generation. I went to UCLA for undergrad. Then I went to Vermont for medical school, where I spent 4 years learning medicine, searching for tortillas, and freezing. So when it came time to apply for residency, I could not wait to come back to LA. And I am proud to say that I go to one of the only family residency programs that has a Latina as a program director, which is a really great accomplishment. And did you guys all know that October 1st was the first ever National Latino Physician Day? No, you were probably at the Bad Bunny concert that weekend.
What's the day?
Because Los Angeles also didn't know, and also proclaimed that day National Bad Bunny Day. But it's okay. We are happy to share that day with other successful Latinos and Latinas who are breaking barriers in our field.
We're in communication with Bad Bunny about merging.
Yes. And today we have 3 professional Latinos who are reshaping health in Los Angeles, and I am proud to introduce them. We have Elkin Salinas, director from the Center of CCI,
Center for Care Innovation.
Center for Care Innovations. We have Dr. Daniel Torres Leveras, co-founder of Salud con Health, and we have Salud con Tech, and we have Dr. Ian Shapiro, chief correspondent, media correspondent at Ultimate. Okay. So we're going to have our conversation. First question is going to be for you, Daniel. On everyone's mind, is the pandemic over? Let's just start off with that.
That's a simple question.
Technology.
Oh, no.
There we go. Teamwork.
The sound.
Oh, it's on the chair.
There we go.
Thank you.
Is the pandemic over? That's a sort of loaded question. And I think, so really, it's arguing semantics, but I would say the pandemic is over from what we have learned to understand what a pandemic is. But if you look in the details, it's not over. So it's a little bit of a complicated answer. But I think for all intents and purposes, we can say this pandemic that we've been living through and struggling through, where we've had to stay at home, we can say that that is over. And that's why we're here together without masks on, right? We're here together in a room without having to, keep a certain number of feet away from each other. But I would like to point out, without being interpreted as negative, I would like to point out that I think maybe like 1 or 2 weeks ago, we had about 2,000 people dying. 2,000, around 2,000 to 3,000 people die from COVID every week, which is about 3 or 4 times more than the flu. And so if we look at it as, is COVID like the flu? Because that's what it would be like if it was completely over. Well, it's not. And so that's why it's sort of like this low level sort of phase that we're in. But we're in a much better place. And so I think the best answer to that question is, right now, what period are we in? Now we're in a period where we can actually, help build the public health infrastructure so that if a pandemic ever was to come back again, we would be prepared so that Latinos aren't disproportionately affected once again. So that's it.
Yes, big applause. I know COVID has affected a lot of our communities, and we probably all know someone here or personally that was affected by COVID. So thank you for that, Daniel. You talked about pandemics, and I know there's been a lot of talk about the COVID pandemic, but we don't hear a lot of talk about the mental health pandemic that's also been happening. Dr. Shapiro, can you tell us a little bit more about how mental health is affecting the Latinx community? What are you seeing in your patients?
I'm going to describe a typical COVID day. You wake up and you're tired. After that, you get depressed, anxious, you smile, you laugh, you call your friend, your partner, you cry a little bit more, you go back. And that cycle has been happening for the past 2 years, where the truth of the way that we handle stuff, it's when we actually know the road that we're going to be conquering, right? We like roadmaps. Then before 2019, we knew that we were going to work, we were doing these things, and suddenly the rules changed a lot. And I'm telling you about the rules because mental health and the opportunities that you're going to be looking for are actually embedded there. The mental health has been always a problem. And us as Latinos, we have more problems with depression, anxiety, also a lot of the addiction component of it. And I'm talking from tobacco to opioids. We are, the structure of our familias has been changing for the past years. Especially right now, as a parent, I can tell you for sure that I was very stressed, and my little kids, and I have like barriers and I have outcomes, and I know that if I have a bad night, I can actually go with Dr. Turner Lloveras and go like, dude, we need a beer, and we can have that type of connection. But imagine our kids. They do not have that connection and that protection. Then a lot of the things that we're seeing right now in our community are the backdrop of all the kids that were home, all the kids that actually saw familiar violence. Because a lot of partners were very happy doing 2 or 3 jobs, but not, and sleeping on the same bed, but really not talking to each other, and especially when you add stress, problems of hunger, a lot of unsafety. Then this is the moment that we need to start reconstructing that part. Being open on our healthcare part of it, our mental health, making sure that we're egoistic. Yes, I'm saying that we need to be centralizing ourselves at the beginning, because if we're not okay, our family is not going to be okay, and our community is not going to be okay.
Thank you for that response. It seems like in a half day, I see 10 patients, about 4 or 5 show signs of anxiety and depression. And it's so hard to talk to, I've found from my experience, older, like 60, 50-year-old Latina grandmothers who have depression, and all of a sudden I'm asking them to take a medication, and I'm trying to connect them to resources. Like, I have trouble connecting with them, and I think that's a lot of, space where we need some more different types of projects and different types of initiatives.
588, sorry, yes.
Yes, good plug, good plug. 588, the new phone number that's replacing 911 for mental health emergencies. So when we're talking about creating new projects that can serve all types of populations, Elkin, the Center for Care Innovation does a lot of these types of projects. Can you tell us a little bit about what initiatives you're part of?
Yeah, I think Dr. Ilan shared a little bit about how healthcare, and the way that we view it, has been this traditional, you go to the doctor's office, well, you call or you show up, it's one of those two, but you go. But the way that we do care, and it forced us through the pandemic, is how do we do care when, let's say, our clinicians, by and large, they're seeing about 800 to 1,000 patients that they're responsible for. This is the panel, right?
Yes.
If that one doctor gets sick, what happens to the rest of those patients, and how do they get served? And so what the pandemic has taught us is how healthcare not only needs to change, but how it has changed. It's changed in the way that, right, we need to think about not only what's offered within the 4 walls of healthcare, meaning going to the clinic, but also how healthcare can be provided outside of the 4 walls. And so with the Center for Care Innovations and the work that I was actually doing before is, what is the new model of care? Meaning, healthcare can be done where it's great to be able to feel, touch, I think from a clinician perspective, right? But also there are things that can be done through video telehealth. Unfortunately, to be very frank, for our populations, right? I think of my parents, mi abuelita, for instance, probably isn't on the telephone, doesn't understand FaceTime, doesn't know how video telehealth works. So one of the things that we've been working on is how do we not only provide the care for patients, not only from a safety perspective, like if they're really, really sick and we don't want them to come into the office, but give them the treatment that they need, whether it's like delivering the medications or et cetera, but also like how do we give them what they need in a way that is kind of adjusting their needs, both the digital gaps, but also the health aspects of it. And so what we've been doing is rethinking, what does that mean from a human-centered design, from a patient-centric, right? Does not speak English, may not be able to read. Like, these are real things. How do we do that? And I think that that's what we've been trying to re-envision, not only in LA, but also across California, across the country. And so with the Center for Care Innovations, what we've been doing is, how do we work with organizations that are there to say, what do we need to be able to engage our patients from their perspective, not in the way that we want to, but in the way that they feel comfortable with. And I think that we've been doing different projects, remote patient monitoring. I know Ilan and I were talking about it, which is another thing, right? So there's the video component, but also there's these technology where you can send all these like echocardiogram, or you can take your temperature, or you can do a is it for a spirometer? Yeah, you can do all that, so you don't have to go to the office. What is it going to be like in the future when let's say your abuelita doesn't have to travel, get on a bus, or right, travel so far, especially here in LA with the traffic, but to be able to provide and get that care, and for the doctor to know, okay, this is what you need next. And so I think that that's what we're doing at the Center for Care Innovations. We're re-envisioning not only like what the future is, but we're not doing it. We're helping people do this because they see that too, that there is a need, and I think that there's a desire to be able to not only learn what we take from what we learned throughout the pandemic, but say, what is the future of care? And so that's what we're doing. And I think that that's going to continue, and hopefully in a more equitable way, right?
Great. I love the way you bring up the idea of human-centered design. In medical school, I actually did learn about that concept, human-centered design, which is the concept of, going through your user, going to your customer and asking, what are your needs? How can we design a program, a solution to meet your needs? And I think in healthcare, a lot of the times, like I come into my patient room and I have my agenda, like I only have 10 minutes, I'm only going to talk to you about these 3 things. But how freeing could it be, right, if I go into the room and say, okay, like how are we going to figure this out? Your biggest problem is transportation. Let's do this. So I think that's really great that you're partnering up with organizations. Daniel, you founded Salud con Tech, which is a digital ecosystem with people from all over different professions trying to bring together to solve this one problem. What is the biggest barrier you see in Latinx communities adopting digital technologies?
Excellent question. So let me answer that question through a story, because I know Ilan shared a story, so I want to share a story too. And I'll tell it through the sort of third person. So my name is Margarita. I'm a mother of 5. All 5 children have moved away from the home. They now have their own families. My husband passed away, and so now I live on my own. My English is más o menos, but I get by because everyone in my neighborhood pretty much speaks Spanish. But when the pandemic happened, or when it started, I was told to go online. I didn't know what online meant, but I knew that it was important because everything was there. When I needed to make an appointment for my vaccine, it was online. When I wanted to get tested because I thought I had COVID, it was online. Appointments for my doctor were online. Supposedly I could get refills online, but I didn't know how, so I always had to go in person for those refills. Even though there was a lot of COVID in the hospital, there wasn't another way. I could go on and on and on, right? And raise your hand if you were ever asked during the pandemic to do a favor for a family member, like to get online and do a form or something like that. So I think probably 70-80% of people had that experience. And so Margarita was my mom, right? And when I wanted to get on a Zoom call with her, because that's what everybody was doing during the pandemic, she couldn't, right? I mean, she was the mom where I came home from college and the VCR clock would blink, and she's like, "Mijo, no sé qué es. Can you fix it?" And so, very, very basic technology. Technology was not her friend, and I was the opposite, where I like, completely the other side. But so I would say the biggest barrier to Latinos adopting digital health as a solution, and it already is a solution for many people, but it hasn't really become a very good solution for Latinos because of digital literacy, right? We talk a lot about health literacy, we talk about all different types of literacy, but digital literacy, or without digital literacy, there's digital exclusion. So you're excluded from these resources. You're excluded from the benefits of being able to use technology. And so that was what led to a project that we started called the Digital Compañero Program. And so we partnered with Promotoras, who went into a Latino community and helped them get online, right? Because getting online is not just access to resources, right? It's a socioeconomic intervention, because once you know how to get online, now you can apply to a job that requires Excel, right? Before you couldn't. So there's many benefits to digital literacy. And so then you have the digital divide, though. What about the digital divide? So we provided computers and hotspots to those who didn't have devices or internet access. And then we started a 6-week program training those who needed digital literacy training, so that they had all of the moving parts, right? They had the device, they had the internet, and now they had the knowledge to be able to navigate the World Wide Web, which also fights disinformation, misinformation. Everyone's talking about, how do we fight disinformation, misinformation? We teach. We teach them how to find reliable health information, because if you don't know how to use the World Wide Web, how do you get your news? You wait. You wait for the memes to arrive on your phone, and that's how you get your news, right? Because you can't pursue health information, because that's why they call it navigating the World Wide Web, right? You have to navigate. It's easy for us who were, grew up in that world, and as early as I could walk, I walked to a computer. That was like what happened to me. But if we can overcome that, then that's I would say that's the greatest barrier, and one that we'll have to overcome if we want to make sure that our Latino community stay safe and have access to everything that they need in future quasi-pandemics.
But you also walked to a stethoscope, right?
Oh, yeah.
Yes, and I'm glad you brought up the way of navigating through technology. And Elkin, you brought up the fact that people find their information on Facebook, right? So I actually want to bring up the fact of social media and healthcare. Ilan, you are one of the forefront in being a medical influencer. The last time I checked, you had over 33,000 followers. Tell me, how important is it for patients to see their doctor outside of their clinic?
I'm actually blushing, and you will see that part. The reality is that our world is divided into areas. One is this, and this is my favorite one, because having the touch, touching, bringing, sharing cards, sharing stories in a physical space has a special space, but also a new place that is the virtual world. And sadly, as healthcare providers, and many of us were never understood the importance of this space. My first pandemic was in 2009. I was a pediatric resident in Chicago, and I started seeing, I don't know, maybe the story resembles something that we're living right now, but people were afraid. They were not taking their vaccines. They were dying because they were afraid of actually getting deported, and they were not getting to the public health departments. And that was 2009. That was H1N1 influenza. And I was pissed off. Why? Because there were a lot of people there in healthcare trying to sell special potions. Grab these vitamins. They're branded with my name. Give me your money. I will cure you, or maybe you will be better. Or the other way around, we're all going to be dying soon. Then start praying. Then we have both extremes, but that was not actionable information for my community. That was not actionable. I was in Chicago, inner urban area, very complicated, schematic social determinants of health. Everything that could go wrong went wrong there. But at least the virus was very nice to us. It was not as bad as COVID-19. Moving forward, I started actually writing a lot of the letters to Univision, Telemundo, that, yes, there's not a lot of information, but the things that you're saying is I don't know how to say it in English, BS. then I had that type of conversation with them and figuring out how can we better communicate. With social media, it actually opens a door for a lot of things. It's a space that entertains, it's a human space, and we all love it. We really do, because you can kind of see your friends and everything else. And I ended up combining a lot of the stuff that I was seeing in my patients every day and the common question, because I was very frustrated. If I wanted to reach, the population, and I started in Chicago, and I'm going to give you the example here. We take care in Alta with 400,000 patients. If I wanted to reach 400,000 patients a day, my wife would divorce me. I would never know my kids. My dog would probably die from hunger, and I would be working probably 9 or 10 days a week. Then that was not compatible with life. But with social media, and starting slow, because it's a slow process for every entrepreneur that it's on the social media part, creating those networks and creating that part, and most importantly, reflecting. Because I try to make sure that whatever I'm seeing on the community with my patients, what I'm hearing, actually convert it to some actionable thing. Because it's awesome to see, the wagging dog, and it's fun and stuff like that. But I really wanted to create a space where people could get that smile, but also very important, to get the information, because it's not about the education on the things that I'm doing. I think that we are all educated. We are having 2 or 3 jobs. We're educated with the stuff that we do, but we need information to choose. And I promise you that a lot of the people that I serve do not have the time to go to NBC or ABC or whatever letter that you have, or Estrella Univision, compared with Fox, and go like a academic debate on, oh no, yes, the vaccines are better. No, they need actionable information. And making sure that at least I give that information there. Whatever we end up choosing, that's our problem. But at least having that door, that opportunity to have that conversation. That's what actually, it's the blessing that I have been doing a lot of stuff in Instagram, Twitter, Facebook. YouTube hasn't worked that much, but all of them have a little tweak, and it's amazing, because that way at least I signal. Right now, I'm signaling, make sure that you take care of influenza. If you have thought about getting your vaccine, think of it twice right now. We need it now. Same thing with the new, and then commercial, completely. I'm not getting paid, but right now that we have these new updated vaccines against COVID-19, it's a good time to do it, because I want to do posadas. I want to walk with my kids in Halloween. I really want to have a nice Thanksgiving, Dia de la Guadalupe, La Guadalupana, and everything else that is coming.
Party too.
My birthday party. True story. You saw? There was. I'm going to leave it there. I'm going to leave it there until it happens. And all that stuff, and that's a conversation that we need to have, because our communities, it's not that they don't want to. A lot of people were like, well, Latinos, educational stuff. It's not that. It's making sure that we're creating that equitable stuff that we're talking, the diversity that we're there, and most importantly, we need to be on the table when all these things are happening. Why? Because if we're not on the table, we're the main dish.
Yep.
And that's the sad truth. I'm going to run away. I have another event at 12.
Instagram.
I'm going to be a little bit late on that one, but please make sure that, right now, part of the ideas that we have on this forum is making sure that we're connecting, we're diversifying, we're voicing out. Equity in health is needed. And that could be from a shampoo to actually mental health services that we were talking about, that part. And that's why this type of forums is extremely important. Daniel has all my information. If not, you can bombard me on Instagram. I have a quick on. Through me at dr_shaps. Thank you. Thank you. Then have fun. I'm here for you. LinkedIn also works for me. And the idea of this is we were the same way that the first national Latino and Latina Physician Day started was when we pieced off. There's no way, and I'm going to give you some numbers, at least for physicians. We're 6% of the entirety of physicians that we have here in the U.S.
Less than 6.
Less than 65 point something. 2% from that 6%, 2% are female. Then you're seeing a unicorn here.
Right.
And not only that, we're 20% of the population. And we are the ones that actually drove, and you can see UCLA papers, things from New York Times, even Fox recognizes that the Latino community was the one that picked up all the bad stuff that happened with COVID-19 and brought us back to where we are. Because you know what? We never stopped. We were essential, and we are essential. And that's why this important forum of equity, bringing tech, and most importantly, outcomes, because sin salud no hay vida. Then, thank you so much, and happy everything.
Thank you. Find Dr. Shapiro on Instagram and all his different platforms. And definitely not leaving us. Thank you again for those kind words. So I want to bring back the conversation to the digital health platforms that we have. Elkin, last year, venture capital funds funded digital health technologies with over $30 billion. If you had $1 billion of those dollars, where would you invest it?
Yeah, I was reading or just thinking about that question, right? $30 billion, that's so much money. I think I would spend it not in one place, but actually I would spread it out. I think the one place, and this is common within the healthcare world, I think not only within hospitals, but also safety net clinics like Ultimed and the safety net, there's been a dramatic shift in just people, right? Unfortunately, at the start of the pandemic, a lot of people lost their jobs. Care managers, RNs, basically the people who care for you that are not doctors. Doctors are always the most essential, but without the people who support them, the supportive services of medical assistants, LVNs, etc., the system would not work. And so for me, I think one of the ways that I would spend that $1 billion is actually in really workforce development. Like, what are the things that those people need to be able to either upskill or even feel more confident in the work that they're doing? I think that healthcare has been seeing a dramatic change, but at the same time, this is actually a figure that, or just the fact that came to my mind just recently. There are people who just graduated, let's say college, that have never worked in an office before. Just think about that, right? So I think workforce development, not only for healthcare, but I think just in general, are those things that I think that everyone needs. But I especially think, again, for our community, like the Comunidad Latina, Latinx community, I think that we need to say, how do I, one, develop the skills that I need to be able to, serve the community I want to serve, but with the skills that I need. And I think that that's where, I hire people, and I think other people are looking for talent. But if they're not prepared, that's hard to make that ask. But I think that that's where I put some of the money. I think of the other ways that I would spend that money within the healthcare world is care management. You talked about, getting your patients have these different social determinants of health, right? For a clinician, I think clinicians, and I think there's other people in the healthcare world, they care about people. They're not looking at the time, they're not looking at the money, can they pay? No. It's like, what resources do these people need? And I think that we need to rethink the way that we're doing care management currently, right? How do we address the needs that are not clinical in nature, meaning needing pharmaceutical or some other type of medical intervention, but what are those needs that are more, let's call it housing, let's call it nutrition, let's call it, et cetera, because those are real needs. And unfortunately, there's a group within healthcare called the care managers. That's what they try to do, but in many ways, I feel like they're overwhelmed. They're overwhelmed because the system is saying you need to do X, you need to do Y, and then you have these really, really big money, the health plans that are saying these are the care gaps that you need to address. And it's it's all coming from everyone. I feel that we need to reimagine the way that we do care management. So I would spend that money to not only think about the workforce, I would love to get more human-centered designers, right? How do we change the system? How do we change the way that we provide care? Because incremental change is okay, but I think we are living in a world that we have demands, right? We all shop at Amazon, we all shop at, or Google. We have a certain way that we expect things, and I think that we need to see the same within healthcare, and we can't all go to Cedars-Sinai, right? And so we need to be able. invest that money in workforce development, really trying to say, we need to upskill you, but also you need to, right, try this out. And at the same time, you need to rethink how we do care management. So I would spend that $1 billion just in those two things alone. I think that we would have better care because people would be less stressed. Clinicians will feel more confident my patients are being served. And at the same time, everyone understands like how we can rethink the way that we're doing things and be more humble, right? Providing that lens of equitable, diversified, like just different way of doing things that we have not done up until this point. Well, the pandemic really kind of taught us how to do it though.
Yes, and I'm glad you brought up the fact of social determinants of health, because so far there's been new research shown that it's not necessarily your, what medical conditions you have, but it's really those social aspects that determine whether you're going to live up to 60 years old, whether you're going to live up to be 70 years old. And actually in my clinic, we're actually rolling out a project screening for ACEs, so adverse childhood events. So now, the first time I walk into a patient room, I'm responsible for asking my patients, like, what happened to you when you were small? Did you have a family member that was incarcerated? Did you ever suffer homelessness? Did you ever, experience sexual abuse? Now, these are really deep questions to be asking in a 15-minute visit, right? And honestly, as a clinician, I'm scared to ask those questions because what if somebody says yes? Like, where do I refer them? How do I open up this wound, and then how do I make sure that they're taken care of? So this is a big conversation that's been happening in healthcare, and it's a lot of work, good work that needs to be done, and we do need more human-centered designers to be addressing these problems. Daniel, I want to tie this into you, because I know Salud con Tech is having a conference coming up. Can you tell us a little bit more about your vision for the conference, and what types of conversations do you want to host there?
Thank you. And I think we're all getting hungry right about now, or thirsty. So I think we'll end with this. So the Salud con Tech conference really is about how do we build a digital health ecosystem for communities of color. And this is sort of relevant to whatever line of work you do. If you're in finance, if you're in housing, if you're in different types of business development, I think each one of us has to think about the current ecosystem that you're working within. And all of the different moving parts that need to be there for that ecosystem to function successfully. And so in healthcare and digital health, that's if you're a founder and you have an idea for this startup, in order for you to be successful, you have to be able to interact with and get feedback from people in government, like Medicare, Medicaid. You need providers, healthcare systems, FQHCs. You need investors. And you need payers, which are the health insurance. And then you need patients, but there's always patients, right? There is that part also. And so what we're trying to have this conference is really have speakers from all of those disconnected silos be present and speak about how the work that they're doing to try to improve the Latino community and other communities of color, and then continue that conversation with them being mentors for upcoming burgeoning Latino founders and investors, so that they can easily get that feedback that they need to get their idea, to get their product out into the real world and make it be successful. And so really building that ecosystem, because it's not really there right now, but with the help of everybody here and everybody else who wants to get involved, we can build that. And it really, the beautiful thing about social determinants of health is that it ties into so many different people. In medicine beginnings, like my medical school and residency, our world was doctors, hospitals, patients, doctors, hospitals. And now we realize, like, oh wait, there's housing. Oh wait, there's finance. Finance is really important, for patients and for doctors. And all these different parts. And so I think it's a beautiful thing because it allows us to realize that we need to be interacting more and getting out of our silos, because that's how ideas form, and then that's how interventions that improve things are created. So if you're interested in that kind of thing, December 2nd, online you can get your tickets. They're free $99, on sale for free $99. So no excuses, no excusas. Thank you.
Thank you, everyone.
Things that we learned in our culture and things we learned from our parents, and have an honest conversation. So I'm really excited to be here and engage in a conversation with each and one of you. So thank you for coming.
Hi, thanks Melissa for having me. Great to see everybody. I'm Nestor Hugo Solari. I'm the co-founder and CEO of Sigo Seguros. We're a mobile first line insurance provider focused on the Latino community in Texas. My background is mostly in finance, and my parents are Uruguayan immigrants. So I was born and raised in northern Jersey, and so yeah, I'll cut there. We got a lot to talk.
We got a lot to talk about. We're gonna start with a fireside question, meaning I'm just gonna ask a question and I just want you guys to blurt out the first thing that comes to you, okay? What is the worst advice your family gave you around money?
Want the whole list or just the top 10? They told me not to buy my second property. Yeah, and I bought my first property. Real estate is a great pathway to wealth. I can say that that's how I got here, or I can say education is how I got here, because my mom also told me, drop out of school, stop being so ridiculous. I was getting my master's degree, becoming a psychologist, when she told me to stop going to school and stop being ridiculous. I was married and I had 3 kids at home, so she thought I was being ridiculous and I should be taking care of my husband and my kids. And now I take real good care of all of them, okay? Including my mom and my sisters and everybody else. Yeah, so our family tends to give a lot of advice because they love us so much, but that doesn't mean that you should listen to them. As a matter of fact, really quick, my friend just recently, I have a G-Wagon, and she told me, I'm gonna get a G-Wagon too. I love yours. And I said, I love it, yes, go, go, go. And so she goes, buys a car, and then I see her again, and she's like, you wanna see my new car? And I'm like, yes. And I walk outside, and I'm like, where is it? I don't see that G-Wagon. And she's like, no, this Armada that I bought. And I said, an Armada? What? That's not a G-Wagon. And she's like, well, you know, I went to the dealership with my mom and my aunt, and they told me, like, don't do that. Don't buy a G-Wagon, they're too expensive. And I said, you know, a G-Wagon is 100% tax deductible. That's why most people that are high income earners are buying G-Wagons right now, because Trump changed the law where we are able to 100% write it off, or because it's considered a heavy equipment that you need for business. So that's why it's so now I'm paying. I said we're probably gonna pay the same for this car, and you're driving an Armada. Yeah. So and she said, well, it's still a new car, and I'm like, yeah, but then you don't feel the way you do when you have a Jeep. When you're in a G-Wagon, you'll make more money because of how you feel about yourself, right? And so anyhow, yes, listen to your parents, but then get second opinions from your millionaire friends.
Gosh, that's a great question. For me, it's going to have to be when I was 14 years old, my parents said, we have the perfect family that you need to get married into, and you're going to be taken care of for the rest of your life. And so that led me to the philosophy of why we're all here, and I'm going to give you the 3 principles of becoming rich really quickly. You marry into it, you work hard for it, or you inherit it from your parents. Those are kind of the 3 fast tracks. Or you can file a class action lawsuit and retire for the rest of your life.
Yeah, I think the first one that comes to mind, and it's funny because I was thinking a lot about it recently. Melissa recommended a book. It was just reading. But my parents were adamant about not taking on any credit. So no credit cards, don't take any loans, save, spend what you earn. And I think particularly when you're looking to materially increase your wealth, you can't overlook how valuable leverage, getting credit, and being able to buy more with your $1 because you can borrow $10. I think is really meaningful. And it's tricky because you can get caught out, right? And then bankruptcy follows you around for a long time, right? But you can also get out of that. And I think there's a lot of value in learning, even if you have a tough time when you're young. But I think that's probably the biggest thing. And I think one of the bigger things that really lacks in the community that I grew up in is just familiarity with that and comfort with building your credit score and
I want you guys to just take a second to notice what's happening in your brains. Everything that you've been told is wrong. And the patterns that we repeat to achieve success and wealth, when they don't work, we're wondering why aren't they working? Well, we're doing the same thing over and over again, expecting different results, right? Insanity, right? And so part of the conversation I wanted to start with you guys, that's why I wanted to start with that question, was what are those limiting money beliefs that you have had to overcome that has completely transformed your income? I know mine. I'll share mine for a quick second. Mine was that making $1 million in my business was impossible. And so when I told my coach and my mentor that one day, I said, I want to make $1 million, and I started laughing. And she looked at me and said, why are you laughing? And I said, well, I know it's ridiculous. She goes, no, it's not. I was wondering if you wanted to make $1 million before taxes or after. That was my money belief that I had to break.
I think the biggest money belief system was that rich people were not nice people. And I recall being in a room just like this, where my coach said, I'm going to make sure that each one of you are millionaires. And I raised my hand and I said, I don't want to be a millionaire. And she was shocked and she said, why not? And then I said, because you don't have any time to spend with your family. You have to get up really early and go to bed really late, and you work a lot, and then you never have time to go on vacation. And then I'm saying these things, and then I realized that I'm inventing this. I don't even know one millionaire, and I think I know what it is like to be a millionaire. And in that moment, I caught myself in like one of the biggest lies that I've been living in, which was that, right? And so like in my household, it was like, we're not rich because the rich don't share, they don't give it to us. Like it was like someone to blame. And I think as Latinos, we probably have that story a lot, and it's not that. So that was the biggest lie. Yeah.
For me, I have to share this because I think a lot of mid-level career Latinos, in life and careers, you can change three things. You can change your title, your responsibility, and your pay, right? And so when you think, you're moving up the corporate ladder, you think you're managing departments. You used to manage a department, 14 staff members, took the company from 38 million to 50 million for FY22. And I was working Monday through Sunday. Really just, my work was my life. And there comes a bandwidth that I did the math. I was like, I'm managing so many people and I'm not being financially compensated for my time. And when you develop an area of expertise and you value what you're worth, you can ask for what you're worth. And for me, that was really transformational, right? Where's the balance? What am I okay with in terms of pay? And how many people am I willing to oversee and manage? And so those are things that I negotiate in kind of my day-to-day.
Yeah, I think the biggest kind of shift in money belief system, I think we called it, was my dad always. So my father immigrated from Uruguay, second grade education, always worked really hard. And I guess the belief is that salary and saving is the way to go. And be committed to your job and be committed to your boss and just working and grinding and you'll get rewarded and you'll be able to save enough for retirement, which hasn't played out well for my parents. And so I think that really changed for me. So to give you to the ending of that story, my father worked for the same company for 35 years, cleaning, building services, cleaning windows. He was the third employee, never got any ownership in the company. And when he retired, he was forced to retire 2 years early and got a pat on the back. And then it was us on our own. We moved to Uruguay, and I'm happy to tell that story to whoever wants to hear it. But I think that was the biggest thing, is really, it's not salary and saving. That's the first step. That's where you get your initial capital to start making the moves that are going to make you wealthy and get you to financial security.
So let's talk about some practical steps to making money, because I know all of you are thinking, okay, this is nice, but how do we make this money? Like, what are some wealth building investments that you guys would recommend for everybody sitting in here? Is it real estate? Is it personal development? Is it stock trading? What are the wealth building activities you have found work best for you?
education. I think that that is the one of the biggest wealth building activities. Right now, I spend about $100,000 a year on personal development. I travel and take seminars. I take meditation retreats. I do a variety of different personal developments. Last night, I was at a billionaire mastermind. There were 4 Latinos there. I was really happy. I was like, because I travel all over the place and I belong to an entrepreneur organization that I actually have to pay to belong to it, so that's an investment as well. And I get to be with other 7-figure earners. So I hang out with people that are succeeding, and I think that that's really important, even if it's going to cost you money. So you guys all owe me some.
Right, it's true. You're hanging out with
Yeah. So do more of this. But I do want to say that I did buy a house when I was in my 20s. And we did sacrifice. My husband didn't want to buy a house. He was very happy living in the back of his mother's house in East LA. And he told me I could live here forever. I'm like, no. And I bought my first house, and then I refinanced where there was equity, and then I bought the second house. And then I bought a third house, and then now I live in a Pimp Daddy mansion.
That's right. I've been there. It's a Pimp Daddy mansion. What is the wealth building activity that you have done?
That's a good question. Life insurance. Life insurance is the best way to get yourself $1 million policy. Imagine if your parents had $1 million policy, something happens to your parents, and God forsake, something happens, you and your siblings inherit $1 million policy. That is super important. Protection of your assets, right? The worst thing, I'm still even having this conversation with my parents. I was like, Ama, you have to prepare your will. I was like, oh, Mima, I'll get to it. Pushing death. I don't want to talk about death. I think in the Latino community, we need to talk about it, right? Prepare a living trust. It's so important. Build everything, put all of your assets into your living trust of what's going to happen to those assets should something happen to you, right? We're not going to live forever, right? You put your life insurance into that living trust so you can take care of the family after. So imagine if your parents did that for you, you're going to be taken care of. 401k, I think having cash at hand when the economy really bottomed out and the COVID-19 happened, for us, we were able to double our assets in the stock market. We went in cash heavy and doubled it. So having chips to play at the table. The other thing that happens to me growing up is your relationships, right? When you hang out with your group and everybody's making $40,000 and you're making $55,000, you feel good. You're like, hey man, I'm rocking, I'm making $50,000 more. But then if you start hanging out with individuals that are making $85,000, you're like, oh, wait a minute, I'm making $55,000. How do I get? Hey, how'd you get to $85,000? And then you meet other Latinos that are making, $125,000. You're like, hey, how'd you get to $125,000? And you reverse engineer. What is it? Was it a certificate? Was it a? You talked about development. Development is so important, right? Certain distinctions within your industry to distinguish yourself, right? So for me, what I did early on in my career is identify 1 or 2 or 3 leaders in your industry, and what did they do to get to that point? And I reached out to them. For me personally, 10 years ago, I contacted industry leaders and I said, I would love to co-author an article with you. So I know these individuals in first name basis only. So for me, that was a huge career accelerator, and I'm sharing it with you. Also, I'm a go-getter. Early in my career, I reached Fortune 100 CEOs by sending a FedEx, and I would do a FedEx signature confirmation. When you get a lawsuit and only you can sign it, your executive assistant can't sign it. So for me, I am a go-getter. I will get in front of any executive Fortune 500 before a conference. I would say, hey, I can't wait to hear you speak. I'd love to meet you, grab a cup of coffee. So I line up. When I fly to conferences, I leverage a meeting, making connections, making introductions, and meeting and finding ways of building partnerships. So.
Rafael and Melissa are 2 of the most incredible networkers I've ever seen. It's awesome. But I'm basically going to repeat a lot of what Hazel was saying. And we think about this a lot. We're a car insurance company. We're focused on primarily native income Spanish-speaking populations. Half of our customers are likely undocumented. And so we think about this very much as an essential way to protect your downside, right? To protect your downside risk. You mentioned insurance. as well, obviously for help. But the way we always talk about it is, okay, starting at the very bottom, right? As you're getting in, you got to make sure you're saving something. So budgeting is the first one, right? Building your savings. Then you got to make sure you're managing the downside. Life insurance is huge. I'm relatively well educated, I have a master's degree. My parents don't have life insurance and they're old and sick, right? And that would have been a game changer in my life if I had thought about it 10 years ago, right? And so I think that's huge. And so thinking about, okay, budgeting, saving, getting that, then protecting your downside, car insurance, life insurance, health insurance, and then kind of using what you saved and budgeted to then start making those investments. And when you're making those investments, I think take advantage of what's out there. I think particularly kind of not being plugged into the network, I think it's really hard, it's really easy for people in our community to overlook the opportunities right there. I wish I could spend $100,000 on personal development, but there's a lot of free stuff you can get online too, and a lot of lower cost stuff. And networking is a great way to start building your own kind of skill set and just working and really kind of building that expertise. But things like your first property, right? The SBA loans, subsidized loans. When you're applying to school, there's a bunch of different scholarships that I didn't even realize were available when I was an undergrad, and I still have undergrad debt that I decided to keep paying off. But I think there's a lot of opportunities to take advantage of free money out there that I feel like are consistently overlooked.
I want to talk a little bit about, I think, one of your favorite topics, Hazel, vision. And I want to talk about the importance of building a big vision and how that has played a role in your lives as you build wealth and you continue to build your wealth. What does it look like for us to build a vision? How do we do it? Where do we start? And how does that impact us as we're building our wealth?
Very good question. Here's a 20. Yeah, so my life completely changed. I was already a psychologist, and I had my own business. I started my business in the garage of my house because I didn't have enough money to rent an office. And I used to have, struggle keeping the kids quiet and the dog from barking and making an important phone call. But that's what you got to do, right? You got to do what you got to do. And I was bouncing checks. I was fist fighting with my sisters. I was divorced by then, and I was a single mom and struggling in all my relationships. So when I went to school and I became a psychologist, it taught me how to do a job. It didn't teach me how to live a life of my dreams, right? And so even though I was a professional and helping other people, in my own life I had problems. So I started, that was when I was introduced to personal development. And even though I spend $100,000 now, I started off struggling and paying, I think $500 for the first course. And I did it in payments. And while I was there at this personal development training, they assigned a coach to me. And the lady asked me, where do you see yourself in 5 years? And honestly, I couldn't come up with anything. I was like, well, I'll be 5 years older. My kids will be 5 years older. And that's it. And she was like, no, but like, where are you going to live, and how much money are you going to make? And I didn't, and I couldn't think of anything. It was like I was living Groundhog Day. Like every day looked like the day before. Like, why would tomorrow look any different? And she was like, well, think about it. And she left. And when she came back, I already had come up with something. In that moment when she left me alone, I feel like I got this aha where it was like, well, if you believe in God and you believe in miracles, what is possible for you? And then I was like, well, if I'm not going to make it happen and God's going to make it happen, then I'm going to live in a Big Daddy mansion. I'm going to have the love of my life. I'm going to get along with my sisters like we're in heaven. And I'm going to fly in private jets. Plus, my daughter will go to college and I'll have an extraordinary life. There's no reason other than that I said that I believe in miracles, that this would happen. I said that because our brains are not used to having us think that way. It wants to keep us safe, and what keeps us safe is same old, right? So if I say I'm gonna, propel off this building, which I have a friend that does that kind of stuff. He's a stuntman. He'll do it like this. My brain was not used to seeing me have those things, so your brain doesn't allow you to dream. And in that moment, what I realized is I don't dream. I don't dream. I have goals, and my goals are based on what I know I can do. A dream has nothing to do with that. And so we're very limited. We limit ourselves. And so thinking of, if I tell you how to make a miracle happen, your brain doesn't know how to make that happen because it's none of your business how it happens. It hasn't been trained to make a miracle happen. That's for somebody else. So because I was allowed to dream, I was able to create this vision. I remember she said it was a 5-year vision. I had everything happen in 2 years. And I didn't invest $1 and I didn't go out and have to get another degree. So vision to me, I think, is the most important thing when you're looking for a partner to date, when you're looking for the amount of money that you want to make, when you want to start a business, relationship with your families, anything at all. I even created a vision before I got here that you're all going to love me. Okay? You're all going to follow me on Instagram. And we're going to be connected. Like my life is going to be so much more enriched because of each one of you.
For that story, please don't jump off of the building.
Please don't, no.
I want to mix it up a little bit. Let's go.
So I guess I'm gonna talk about two. You guys talked about the health insurance panel. What was the question before?
Vision.
The big vision, right. I think about, so a couple things. I think, like I said, egoísta, right? You have to put yourself first. You have to put your dreams, your wants first. You have to make sure you're financially secure before you can make sure your family's financially secure. You have to make sure you can help yourself before you can help others, right? And I think a lot of that starts with being clear on what you want with your life. What you want, I think in decades, oftentimes, I think, what do I want my life to look like in 30 years from now, in 20 years from now? And kind of try to work back towards what it is now, what I need to do. The other thing I want to refer to, Dr. Daniel was saying, and I'm going to disagree a little bit with the issue of digital literacy among the Latino community, but I'll tell a quick story and kind of tie it back to the purpose and kind of how it ties into my vision. About 10 days ago, my mom was in a really serious car accident. Fortunately, she's okay, but the car flipped, it's completely totaled. Truckers had to get out, break the windows, pull her out of the car. And so, fast forward a couple days, she needed help filing the claim, and she asked me to do it online, right? Kind of similar. There's a lot. I mean, Geico has a great experience online and something we're going to copy at Seago, but you should copy as much as you can. But it was difficult. It was difficult for my 65-year-old mom who prefers Spanish to do that online, right? But then I started thinking, well, it's not too hard for her to use Twitter and enough to get kicked off twice already. I'm not even sure exactly what she's saying on Twitter, but she's on WhatsApp, she's on Facebook, and so I don't think it's digital literacy. I think it's incumbent upon us to build the products that our community needs and to use the way that they use technology, they use things. And so that's really how we looked at things when I was founding Seago. And people are like, oh, well, your native Spanish-speaking customers aren't going to buy anything online, right? They want to go in person and wait, and they want to talk to someone. And so far, it's proving out great for us. But that was really, I felt that it was incumbent on me to build the right digital product for the customer, and not necessarily incumbent on the customer to become more educated, right? We need to meet people where they are, and I think that really became part of my purpose and tying it into kind of wealth building, right? Because ultimately, money is a great motivator, maybe to $1 million, but every time we say million, I want us to say billion, right? And not that everyone needs to be a billionaire, but I think we're talking big and we're talking about changing things and changing society. I think that's the scale we need to think about, right? That's how big it is.
Did I tell you guys that this group thinks big or what? I told you $1 million was nothing. All right, go ahead.
For me, I've been big vision, big picture since I could remember. Even the creation of Latina professionals was a big vision, right? The creation of Latino professionals was a big vision. About 5-6 years ago, many of our board members, the originals, the OGs, are here in the crowd. It's I joke around on the Latino Walt Disney of creating Latina professionals, and with the Latina professionals creating Latinas in the boardroom, Latina equal pay, working with our U.S. trademarks and patents attorneys, and so building these brands and sub-brands and Latina Professional to a point where they can hold 20 intellectual property. I mean, that's impressive. And what's happening in our Latino community is we're booming, and Fortune 500 companies know this. And so what they're doing through the DEIs and the ERGs that are creating these wonderful events during Hispanic Heritage Month, they're trademarking a lot of the intellectual property that exists in our community. So imagine if Burger King, owned Si Se Puede, right? And it's happening. I talked to too many intellectual property attorneys that are filing like crazy to protect these names, these brands that are being created by our community. So for us, we're in stealth mode. Well, not anymore in stealth mode because I just kind of gave you guys our playbook. But really, being big vision, being a leader, doing what other organizations haven't done. And then for me is I love surrounding myself with very driven people. I think that makes a huge difference. I talked about, when you're making 55 and you hang out with individuals that are making 40, you feel good. But if you're making 55 and you meet people that are making 100, you don't settle. You feel uncomfortable. You find ways of getting there, and then you just keep scaling, right? 300, 400, $500,000, and you just keep going up there, and you figure out ways to invest, ways of kind of figuring out this game of Monopoly. When it comes to vision, I think what I love about my dad is an incredible business individual, made a lot of money very, very early on in fulfilling markets. And so for me, I grew up, under my house, my rules. So at 17, I said, okay, I'm moving out of the house so I can create my own rules. But they would always talk about, the trifecta of debt, right? Debt when you go to college, right? It's great for Latinos when you can get scholarships, when you can get your full education paid or pay very minimally for education. I've been sitting on the board of the Navy League for 16 years. For some Latinos, it's great to go to college, but if college isn't for you, for some of our Latino community members, maybe the military is for them, right? The military is a great example of creating structure, of getting out of the barrio and coming out completely decorated as a lieutenant. And know so many Latinos that have taken advantage of the Marines, the U.S. Coast Guard, the Navy, and come out with an education, a master's, a PhD in engineering and management. And I think that's the beauty about our community. I think there's an incredible opportunity. We're growing, we're booming, and I think companies are taking notice.
Thank you, guys. I'm going to do a quick poll because I think this is going to be interesting for our next question. If I said, and I want you to raise your hand if this rings true to you, if I said, I love money, how many of you here agree? Yes! Okay, guys, put them up real high. Because for a long time, and I think I heard some of you guys say this, I did not love money, right? Because in our culture, money was shamed. It was like the bad thing. The bad people were only the ones with money. And so it took shifting that relationship with money for me to start to attract even more and create even more because I desired it, I loved it, I wanted it. And a large part of that was the books that I read, the habits that I started to implement. So what are the habit or maybe books that you've read that have really helped you like connect more to money, the wealth creation of that?
Think Like a Billionaire by Trump.
Oh, interesting.
Yeah, that was one of the books that I read before he started bashing the Latinos. I would never read anything he's writing now. But yeah, I watched that. I watched The Apprentice. I watched The Lifestyles of the Rich and Famous. I watched all of that stuff, and I didn't think it was wrong to have it. I started getting comfortable with it, right? So I started to study what millionaires are like instead of just inventing what I think it's like, right? And what would I do? It's not money for the sake of having money. It's money for what money can do, right? So with money, I was able to help my sister put a down payment for her house. I also paid for my other sister's wedding. And I bought my other sister a house. Everybody's pretty broke in my family, okay? So with money, I'm able to do that, right? My niece got in trouble with the law. I paid for her lawyer. So that's what money does. Whatever amount of money there is to help, right? And then I pay for my personal development, but I also pay for my family's personal development. They also need that. And I offer that, and it's really remarkable, and that's what money does. And so as long as you know what the money is for, then it's okay. So for me, right now, I do have aspirations of that B word, billionaire. And I have been intentional in getting into groups where there are billionaires. And I've met 4 lady billionaires recently, including the owner of the Chargers here in LA. She's a female billionaire. And then the owner of the Utah Jazz, a billionaire female as well. So those are the people that I get to talk to and hang out with. And yeah, when I said the B word, my friend who's a very successful, wealthy woman, she told me, "Why do you want to be a billionaire? They're not nice." And I'm like, I don't know that they're not nice. I don't, you know. And so I started to meet them, and yeah, they are nice. And I'll be a nice one, I promise.
Melissa, I think you mentioned it, but for me, it's really come down to habits and also, Hazel, you were mentioning kind of mindfulness practice. I think for me, being conscious of the decisions you're making, what you're doing, where you're investing your time and effort, has been a game changer for me, really. Launched my company about 5 years ago, and over that time, I've really stepped up my mindfulness practice, therapy and coaching and meditation, and I think it's all really helped compound a lot of learnings from these books, from a lot of these, like the one book, for example, like Atomic Habits. I think the power of consistency, small things over time can really compound and add up. And I think that's probably if there was one thing I think that would apply across the board for wealth, whether it's investing in yourself, whether it's investing a little bit or saving a little bit, the power of compound interest and compounding those wins and taking those wins and creating more wins with those wins, I think it's probably been the thing I've leaned into the most, especially recently as we really started to take this thing more seriously.
Gosh, I don't have a book per se. I love reading books. I think books, I love Paulo Freire. I don't know if you guys know Nobel Prize winner Freire. His philosophy says that all of us have a missing piece of the puzzle. So in other words, you guys have a piece that I need from you as much as I have a couple of pieces that you need from me for you to get to the next level in your career and life. And so I love that philosophy because with that, I devour, I'm an avid reader to the point that I read 150 books. Anybody that follows me on LinkedIn knows that I write a lot. I've written over 320 articles in the past 6 years. I've already finished 4 books. Releasing the first book on careers. And that much came out of conversations of dealing with what's happening with the economy. Many people are losing their jobs. And me sharing the strategies with them in a book that could magnify and help our Latino community. For me, that's super important. For me, when I get interviewed with a panel, because I oversee departments and the decisions that I make impact organizations. And so what that means, and I am comfortable being interviewed by 10, 20 individuals, and they're day-long interviews, week-long interviews. And what that means is when I have a sea of individuals in front of me, and they put you what I call the FBI chair, and they're like, tell us about yourself. Why do you want to work here? If you start answering those questions, you have already lost the job. And so you have to show authority. And so what I do is I thank everybody. I love sharing this tool. Thank you very much for having me. But before we begin, if you could tell me a little bit about yourself, how long you've been in your role, and how you're directly going to be working with me. Is this person somebody I manage? Is this somebody I report to? Is this a CFO? Is this a COO? Is this a CDO? And so I need to know the structure and who am I talking to. So when they ask me a question, I can give them the correct answer, if that makes sense, right? An answer, finance speaks finance lingo, right? Management speaks management lingo. So if they're asking you a particular question, the ability for you to shift. I think a great book that for me, I carry with me is called The Relationship Edge by Jerry Acuff. And the reason I love that book, he says, high net worth individuals are very, very, very busy. And if by any chance you ever have an opportunity to meet them, and exchange a conversation, a 5-minute conversation with them, if you don't know where their kids went to school, their favorite wine label, where they vacation, during the holidays, you're doing a terrible job building relationships. And for me, I think that's a great book that laid the fundamentals for me early in my career in learning how to build relationships. Aside from that, I've read Harvard's business, all of Harvard, Dean Nitin Noria's Harvard business books. I've read NYU, Yale, UCLA, Anderson. And so for me, I love looking at businesses from different lenses. What does that mean? I tend to, when it comes to Harvard, are there any Harvards in the crowd? Harvard? Anybody? Harvard? Harvard thinks they have the best business case model. And I loved reading them because the problem with Harvard's model when it comes to business is they say, well, here's Hertz and here's Enterprise. Enterprise had a better business model, therefore they won in the market. But the reality is under the table, there's a lot of class action lawsuits, intellectual property where you shackle a company in the court system. By the time they get out of that court system for 2 years, they've already exhausted their war chest. So there's all these things that happen. So for me, I love MIT's way of building businesses. What that means is I look at a business from an engineer standpoint, right? So what does that mean? Are we building a company for 10 years? Are we building a company for 50 years? Are we building a company for 100 years? Are we building a company for 200 years, right? Are we using wood? Are we using cement? Are we using steel? Are we using bottom suspension, top suspension, right? The San Francisco bridge is different from the New York bridge. And so I threw engineer analogies at you, but what that means to me is resources. How much money do we have? What's restricted? What's unrestricted? What funds? What assets do we have? And that's how I scale businesses.
Love the practicality of that advice. Thank you. So guys, let's get this back to you guys. This is what it's really about, right? So how many of you would like to make an extra $1,000 in one day? Me? Oh yeah. An extra $10,000 in 1 week? An extra $25,000 in 1 month? Yes. So what I'm gonna do, my panelists don't know yet, I'm gonna ask them for a hack. If I was to give you a challenge and say, I dare you to make an extra $10,000, I'll make it small, I'll make it easy for you guys. You guys think big, right? If I was to say, okay guys, I want to make an extra $10,000 and next, I'll even give you 30 whole days. You could probably do it sooner than that. If I wanted to make an extra $10,000, a lot of people in this room that want to make an extra chunk of cash, what's one thing you would go to market and do to make that extra $10,000? Who's ready? Who's ever ready? Come on, Nestor's got, he's got, look at him, he's got this.
So I'll start with what I would do, and I think I'm fortunate that I studied and gone to school and started a company, and so now also, not with as big a social media following, but with a couple thousand people online, I get asked for phone calls and interviews, and so I probably just set up a Calendly, charge a couple dollars for my time, and start taking phone calls from strangers that want to. I think that kind of goes back to investing in yourself, investing in your abilities, investing in your expertise, and kind of also how to provide value. So that's kind of where I'll take it next is think about how you can provide the most value to whatever customers, right? What do you know, what do you have that you can provide, right? And even some legwork. I mean, I didn't want to cop out and say, go drive Uber for Uber 12 hours a day, but you could also do that, and there's a lot of side hustles. There's a lot of odd jobs. There's a lot of work like that that you can even start with and start kind of investing that money and kind of parlaying it. But I mean, I go as simple as that to
Which, by the way, takes a brand that you started to build.
I'm going to answer, I'd love to give you an answer. My younger me would have said, acquire a bunch of apartments, homes, that have 3 to 5 bedrooms, fully furnish them, and rent each bedroom out, and it covers the mortgage, and you can make a killing. I did that when I was younger. In every market that I moved to, I immediately blocked 2 to 3, 4 mortgages, and immediately put a bedroom, a dresser, and rented out the place. So let's say the property was, I don't know, 4,200, and renting out 5, 6 rooms. I made $6,000, $7,000, and I scaled. That's what I did when I was younger. Now I have a small groups of individuals that work for Morgan Stanley and some of the big, huge firms, and it's a small network, about 5 of us, that I started a group of investments. And so what we do is we keep an eye on ticker on certain stocks that are devalued, and we immediately put cash, and we always double or triple our money, and then get out immediately. So that's what we do.
I'm glad I didn't go first because I had a joke on my mind. I'm gonna say it, and now it's last. I'm last, so that's perfect. The fastest way to make money is not to spend money. So if I stay home and I don't go anywhere, I'd make $10,000. Really good stuff. What they said, of course, stocks, and for me, I just volunteered last week at Salinas, in a prison in Salinas, and these people that are about to be released from prison, they're in a program called Entrepreneur in Training. When they are released from prison, they have a really hard time getting a job. So they partnered up with the organization that I belong to, and we went to visit them and we reviewed their business plan. So I would say that I'd love to invest in other people's ideas and leverage that. That's what I would do. Yeah, and plus I'll tell you, I haven't worked in a long time, but I do have a business. We are vocational return to work counselors for injured workers. That's my brick and mortar business. We're the largest here in California. And I could, if I had to, I could pick up the phone and sell. So I could work more hours. And don't do that to me, but I could.
I won't do that to you.
All of us could, add a Saturday.
Yeah.
And it would change your life, probably.
That's why I ask it, folks, because I want you all to think about a number right now in this very moment. Come on, dare to dream. Let's do this, guys. We can do it. It's really hard, but I promise we can. I want you to pick a number. Make it realistic but exciting. That's usually the right sweet spot for an income that you want to make, right? It's not too overachieving where you're going to be like, oh, I was never going to make that anyways. But it's not too small where it's like, obviously, you could make an extra $1,000 this month, right? So find a number in your own minds. You don't got to shut it out. If you want, you can. Pick a number this month. What are we, in October? The beginning of October? Right? The middle already? Damn. All right. So pick a number. October, let's just say that in the next 30 days, I want you, girl, if you want, you don't have to. If you don't want to make more money, you can sit here and not do anything. But if you want to make more money, pick a number that excites you. $5,000, $10,000, $70,000, $500. Make a number and decide, I'm going to make an extra $5,000 in the next 30 days that I did not expect to make, and see how your life unfolds and presents you new opportunities that you wouldn't have seen, right? Because if we didn't have Hazel sharing, if we didn't have Nestor sharing about how he built his wealth and Rafael sharing about the apartments, we would all be sitting here 30 days later with no extra income. So I don't want y'all to walk away and make no money. I need y'all to make some money here, okay? So now I'm going to open it up to you guys. What questions, as we've been talking, have been brewing in your mind? What limiting beliefs have you been thinking like, oh, of course Hazel can do that because she's already rich? What are the thoughts that you really need answered that are going to help you break whatever glass ceiling you're at right now with wealth? Raise your hand if you want to ask the question and we'll pass you the mic. Yes, brave humans back there. Come on up. Come on up, ladies. Be brave. There we go.
My daughter is a new registered nurse. I'm very proud. Educated parents have educated children, and I wanted to quit school so many times, but I knew that she was looking at me, so I'm glad that I did. I was the first one I got my high school diploma at 30 years old, and I became a psychologist at 36, and it was all because, I wanted that for her. I wanted her to have a better life. Right now, why I mentioned all that is to tell you that there's a program for nurses. There's like a zero down payment for investing, and right now she's actively looking into that. So yes, I would say we are, and I always look for opportunities. So if anybody else is in real estate and there's an opportunity, let me know.
Nurses are the real heroes.
That's right.
So to your question, I have to share this. I have a mixed feeling with real estate. Real estate on the East Coast, when you buy a house, it needs a lot of maintenance. your hardwood floors need to be varnished every 2 years because of the salt. Your roof goes through a beating, and so I joke around, as the value of your house goes up, it's all the money that you're pouring into to repair it. And so when it comes, I had experience with my first home where the East Coast, and in Washington D.C. I lived there for 7 years. It got battered, and so the joke was, yeah, the value of it is going up, but it's all the money I'm pouring in, all the money that I'm trying to save for other assets and other investments. It's going into the home. When is it time? Test 1, 2. But when it comes to my family owning a basket of real estate, absolutely, we have a basket of real estate of assets in premium cities across the United States that we move, we shuffle. It's kind of like monopoly, sell 2 homes that get the cash value, buy commercial, residential real estate. So that's something I'm very heavily involved. For me, is I was going to launch a business venture with a good partner of mine who worked for Apple, and unfortunately, about 7 years ago, he passed away. He was heartbroken, and I drove all the way to San Francisco to be with him during his last days. And when I walked into the bedroom, he had passed away. So for me, it was devastating because we were already going to buy Kentucky Fried Chickens that had gone out of businesses, and we were going to work with developers to give the developer, allow the developer to. 1 second. We were gonna work with Kentucky Fried Chickens that had gone out of business around the Bay Area and around California, and we were going to convert them. So we were going to do all these little stores at the bottom. We already had a developer that was going to put 60% of the cash value to build this out, and he would keep 2 or 3 of the floors, and we would keep a couple of the top floors, and then all of the small businesses. So for me, when it comes to business, I follow the philosophy of my dad. In America, you invest in a business, and sorry, the business didn't go well and you lost all of your money. My dad, I learned from him, is always buy when somebody's desperate to sell. When somebody doesn't want to sell and you want to buy, you're going to pay top dollar. And when somebody's a little bit desperate to sell, but not too desperate, you're going to get a discount, right? So I always operate with that philosophy when it comes to assets. So yeah, that's a little bit kind of when it comes to real estate. I hope that was your question specific to just real estate in general? Or?
Since you both talked about real estate purchases,
yeah.
And with the interest going up and prices not really moving, I'm just wondering if you guys are acquiring more assets as far as real estate.
For us, we're looking for the land we have in our baskets is developing those lands into proper multi-use assets. So that's what we're looking into in the next 2 to 3 years.
Where the interest rates were at all-time low, and that was incentivized so that we could buy property. But what ended up happening is that the people who bought property were the ones with a lot of cash on hand. And so it was a bidding war that where everybody was losing because they didn't have the money that these big corporations did to buy these properties at a low interest rate. And so what I wanted to say with that is that just because the interest rates are really, really high doesn't mean you can't refinance at a different point in time and take advantage of the fact that you're not going to get outbid by an all-cash offer right now. So sometimes the things that we think are like missed opportunities are actually like our way in, because not everybody's going to fight with you over a 10% interest, which I know is not the case right now. But still, no one's going to really fight with you right now. So there is a big opportunity for us who maybe don't have all of the millions ready to go on hand to buy property, but with the intention, be smart about it, with the intention to refinance. Ask those questions up front. Don't wait till you buy the property and then say, oh shit, I can't refinance because it's rent controlled or this or that. Ask those questions. How fast could I refinance this mortgage? Show me that paperwork. And then you will be able to start the process. But don't wait till the interest rates go down to think about this. If you think you want to buy, start looking into it now and find the programs like Hazel's daughter that exist to support our community for down payments, because they exist.
Thank you.
Yeah.
Melanie. Yes. Hi everyone. I had a question for you. So you guys all talked about your wealth in your business wealth in your relationships at home? Like, how important is it to find like a life partner who's supportive of your job, and how has that been in your post? Like, right away, make your life with your success in your career.
Your relationships are 100% correlated with your own success. As soon as I started fixing the relationships with my sisters, remember I told you I was fist fighting with them? I was a psychologist, and my sister was a police officer. That's why I stopped fighting with her, actually, because she learned how to professionally fight. But yeah, I got smart. She's gonna hurt me. Yeah, so once I started working on those relationships is when everything started to change for me in terms of wealth. I became a generous person. I gave love instead of criticism and judgment and punches and hair pulling. And in my relationship, also, my current relationship, I've been in a steady, healthy relationship for about 15 years now. Yeah, and I call him my eternal booty call.
He looks like a booty call too.
Yeah, he's not. Yeah. So last night my phone was ringing and I said, oh, my booty call. My booty call's outside ready to pick me up. But why I mentioned that is because I work on our relationship, in that I call him my booty call because I always want it to be exciting and sexy, because I've been married. I know how it gets, like you get into slumps. I work on my relationships. I work on how to make it exciting and keep it in flow. And right now, my relationship, my partner, when he picks me up, he speaks into his lapel and he says, Madam President is exiting the vehicle. So because of him, I feel bigger. I feel more capable. I feel supported. I feel loved, validated. Like, I really feel like he adds so much to me, like a success tool. Your partner should be all of that to you. And I envisioned that first before he became that. I already knew him. He wasn't that. As a matter of fact, I had already broken up with him. And then I created that vision that I already mentioned to you guys. And I did say I want the love of my life, but in my mind, I created all the details. And it was somebody that would honor me, somebody that believed in God, somebody that would be with me when I was sick and dying, in the good times, bad times. I created all this, man, kind of like computer science, and then the person came to life. That's what I did, and I already knew him. He completely became that. But when I didn't know what I wanted, he didn't know how to give it to me. So we have to be very clear about what we want and get it. You will get it. People will give it to you.
Yes.
So I'm not married, but I think that there's two things I'd add here. I think one, in the process of growing my business and all that mindfulness practice I was talking about, I think it has become such a strong part of my communication, my building relationships, that I think is important. And just as much as I'm sure Hazel crafted the man of her dreams, I'm sure she built herself up. We work in a relationship together, and a lot of that communication, maybe not as much, but you build your relationships together, and I think that's important. And it's important that they fit in with the purpose and the vision and the values you have, right? And kind of also related to what I was saying before, I mean, if you're surrounded by a group, and we use a crude example of money, right? But if you're surrounded by a group of people that make less than you, it's not going to incentivize you to make more. If you're surrounded by a group that makes more than you, if you're not, you might be incentivized. But I think similarly, you need to be around people that are going to motivate you, and you need to be that for the other relationships as well, right? Relationships are a two-way street. And I think this whole journey for me of starting a business and in general and mindfulness.
Test 1 2. That's a really good question for me. You guys have 10 minutes of therapy? Okay. So a little bit about me. I'm on my third marriage. Early in my career was my number one. I mean, doctors, lawyers, individuals where you're married to your job, it's very difficult to have that balance. And early in my relationships, my career was my number one. And, when you romance somebody, you pay attention, but then eventually your priority goes back and your focus and your attention. And so that led me to a great tip. I always say people that are going through divorce, I say divorce is like a Brazilian wax, very painful in the beginning, but best thing after, yes, I said it. Is anybody divorced in the crowd, in the audience for divorce? Yeah, so you know what it means. It's very painful. It's one of the most painful, debilitating. I have mentors of mine that I always say that there's a junkyard of CEOs that their Achilles heels was a divorce or having to deal with that. For me, my first, I had to deal with the division of assets, having somebody coming back into your life and saying you're a man and you need to take care of me, and having to compromise that. Then I went through a second divorce, and then the division. You build wealth, and I say divorce is a great way to cut that wealth in half, right? So it's because you have to then divide everything. So what are you keeping? What am I keeping? I get to keep that. No, actually, that was a gift from my family. You don't get to keep that. You have to compromise all those things that you've worked so hard to build. Then you have to divide them. So for me, it's one of those things that Melissa recently, I was having a conversation with her. We were having this conversation back and forth in Latitude. The importance of placing your spouse as your number one. Super important, right? And so for me, somebody that's go, build, scale, take over the world, jokingly, how do you balance that, right? Learning to take a step back. I think that was an important lesson.
I think what I hear you say, Rafael, I think what everyone's hearing you say too is good relationships can make you money, but bad relationships can take away all your money. So the idea of understanding that a bad relationship is probably the cause of you losing money too. So being really mindful of those relationships that are only going to bring you down, which a lot of us have in our lives. If you're thinking about somebody, cut them now. Guys, I'm not joking. I'm so serious. Okay, one more question, and then we're wrapping up. Okay. One more question. Yes. Oh, yes! Oh, yes, girl. Come on.
Get up.
Okay.
So, introduce yourself.
I'm sorry?
Introduce yourself.
Oh, I'm Summer. I'm a filmmaker and editor.
Yes.
And I'm excited that you're all growing into so many different directions. And you wear many hats. And I wear many hats, but at some point it comes to a wall where you get overwhelmed. So I wanted to see how you deal with overwhelm. Even though it can be like, yes, medication here and there, but at the same time, there's always like going back to your routine or changing your routine. So yeah, that really takes that energy. So even for me, like having to reach like more income, that just brings me to the mind of like, well, I need to have that energy ready to receive that and continue that. So how do you deal with that?
Let me start with this one because I know exactly. And by the way, shout out to Summer. I met her 1 year ago on Instagram, and this is the first time we met in person. I just want y'all to see the power of social media. That's social. I posted this event, and she's like, "I'm there." I'm like, "No way." We've been talking on DMs for a year, and I never met her. And she's a video editor, phenomenal. If anyone needs one. So, Summer, you talked about overwhelm, and I want to hit on this because I suffer from this. Like, it still shows up. I don't think these are the things that ever go away if they're in your pattern. So know that, right? But for me, like, I grew up with like hoarder parents, like parents who had a lot of stuff. Like, we never had enough, so we had to just keep buying more clothes, buy more things. And then I would overeat because I had to eat a lot because there was never enough food, right? So there's this concept, especially in our Latino community, that I want to introduce to make sure we know this, right? There's this concept of never enough. And there's this concept of always needing more. Like, because I'm not enough, I need more. And so what it does is we create this cycle of overwhelm. Intentionally, subconsciously, we decide, like, I'm going to overwhelm my space. I'm going to overwhelm my mind with 5 different projects to work on. I'm going to overwhelm my space with 5 different toothbrushes. I just want you to imagine what it would be like every morning if you had to decide what toothbrush to use. That would be exhausting, right? Like, well, maybe the blue one today, maybe the pink, right? So that's what we're constantly doing in bigger, more impactful ways, right? We're not getting clear on what's most important. So we're overwhelming ourselves with 100 non-important things. So for me, like when I had to cross that border of overwhelm, I had to decide like, what is the most important thing? Like, what is the thing that if I don't have this, if it doesn't work out, then I can't move forward? I'll give you an example. The other day, I couldn't fly because I couldn't find my passport. I could find my earrings, I could find my toiletries, I could find my bikinis, but I couldn't find my passport. And it was a reminder that, Melissa, you're disregarding the most important thing. The most important thing is a flight ticket and a passport. Everything else is just noise. And so my recommendation, my 2 cents that worked for me was I started journaling every single day. I was like, I have too much things in my head. I'm gonna journal. And every week I decided I was gonna declutter a corner of my house. Okay, today we're gonna do the bathroom. Tomorrow, next week we'll do the kitchen. And the more you start to get rid of things, the more you start to create space in your mind and your energy in your home to welcome new things. You know, when they say you're attracting a new partner, they say to sleep on one side of the bed so you create space for your partner to sleep on the other, right? Can't tell you how many times I've gotten a comment, Melissa, you sleep like a starfish. I'm like, well, I wasn't ready for you. I didn't create space for you yet, okay? I sleep like a starfish. So I would not share this with them, but I really understand that pain point because we go through hoarding periods, and whenever you're feeling a lot of overwhelm, that's just a sign. That's just like, oh, girl, you got too many things going on. Prioritize, cut the fat. And you just got to be intentional about cutting the fat, because we all suffer from this.
Very good question. So many things came to mind, including what she had just shared about having a lot of things, nuisance things going on. Just recently, I found out that your eyes see everything, but we don't notice it. But your brain, since you don't notice it and you're not present to it, your brain thinks that you might need it later. So it stays there for you in case you need it later. And they have put people under hypnosis, and people are able to recall license plates, how many red cars, how many blue cars, how many white houses on the way home. So that's a lot of times why we feel overwhelmed, because we're not present. We're dealing with where you're with your child and thinking about something else. You're with your partner and you're thinking about work. You're at work thinking about whatever you don't have in life that you'd like to have. So that's one thing, being present. I meditate. I go to meditation retreats. I meditate 4 or 6 hours a day at these meditation retreats, and I incorporate them into my life. I think that helps a lot. I also want to say that it is just a mindset to be overwhelmed. It's just a word, really. You know, sometimes I feel overwhelmed, let's say, and then I just get busy doing something. I just change the channel and I'm not overwhelmed anymore. It's just like, oh, what happened to the overwhelm? I have 5 minutes. It doesn't exist. You can't touch it. So it's something that you're inventing, right? And so you have to expand and know what your capabilities are. And so, anyway, I could say so much more about them.
The psychologist keep going.
I want to tell you, okay.
I'm just going to echo what they both said. This is something that comes up a lot with new founders that reach out and want to talk about starting a company. Like, how do you choose what to work with? And I think I always frame it as ruthless prioritization. Exactly what Melissa said. What do you have to do, and what can wait, or what do you not have to do, or what can someone else do for you, right? And kind of writing things down, getting them out of your mind because you know they're safe somewhere. You'll see it in your notebook at certain people. I keep going back to mindfulness, but honestly, it was such a game changer for me. But I was more intentional of just meditating a couple minutes every day. I think that really helped. But and minimizing your decisions also, right? Like 5 questions. I'll wear a white shirt, a black T-shirt, or a Sigo Seguro shirt. That's what I'm wearing until I exit my company. And maybe a suit if I really get forced to, but I usually do. So I think, again, really trying to minimize the things you don't need.
Just going to add, separating everything between needs and want. What is it that you need in half the side of the page and what are your wants. For me, when I did that, I realized that I had a lot of wants. And letting go of those wants that take time, space, and energy to go after.
All right, guys. That's a wrap for our event today. I want you guys to know how grateful we are that you all came and made it out for yourselves today. Did you guys have a good time? Yes or yes? Yeah. Let's give a round of applause to our speakers and a very special round of applause to Rafael, our Latina Professionals founder, the visionary himself. So freaking honored to be able to work with him on this and so many future events. So if you really enjoyed today, this is just the first one kicking off from COVID. I'm so grateful that our community was small and intimate the way it was today. Makes it so much more special. Don't leave here without making at least one new connection that you're gonna stay in touch with. I promise you. What did they? Someone said it to me, Dr. Daniel. You told. What did he say? If you don't network, you don't work. What was it? No. Network or no work. Network or no work. Dr. Daniel told me that one earlier. So do a little bit more mingling. We're gonna be wrapping up, but take your time, grab more drinks, grab some food, and then if you guys love this event, stay tuned because we're gonna be doing way more. So we'll be announcing some future events, and we hope to see you guys there. And also follow the speakers. I'm gonna write their Instagram on the whiteboard. So before you head out, write it down because if you want to change your net worth, you gotta be around the bed. So, all right, thank you guys.